Very good afternoon, everyone. I am Tamara Koshevich, a lymphedema clinical lead at the Princess Grace Hospital, and I would like to introduce our lovely colleague, Natalie Phillips, Senior Clinical Manager for Haddenham and CNS in lymphedema at the Oxford Lymphedema Practice. And Natalie will talking about her webinar today, Do You Have Lymphedema? Getting the most from the treatment. I would like to thank everyone to joining us. And after the main presentation that Natalie will give today, there will be a live questions and answers with the speaker. During the webinar, if you have any questions, feel free to pop your questions to the chat and we will aim to answer them later. I will let my dear colleague Natalie to give us our presentation now. Thank you.
Thank you to the British Lymphology Society for inviting me to present this session today. Thank you for joining me on what has been a packed Lymphedema Awareness Month. I'm sure you've taken a lot from it, as I know myself and my colleagues have. So today, as has already been said, we're going to just be discussing getting the most from your treatment when you've been diagnosed with lymphedema. But why are we here? We're here to increase your understanding of how we can all work together to ensure that you can get the most from those treatments that are offered by your lymphedema clinics or from accessing private services. And it's all about effectively managing your lymphedema. And really, this session's about us all considering the guidance that we give you as lymphedema practitioners and how you inform those choices and those treatment choices. But before we go on to treatment, I think it all starts with achieving a correct diagnosis. So for you, you've been told that you have lymphedema, but do you truly understand that diagnosis? Have you been offered diagnostic tests such as a lymphoscintigraphy, which would show how your lymphatic system is functioning? This allows you to see the whole picture and increase your understanding of your individual function. Many lymphedema clinics within the health service should be able to offer this, but it's very sporadic around the country as to when and where you'd be able to get this done. It really allows us to look at the difference between a primary and a secondary lymphedema and how your lymphatics are uptaking the dye that's injected, how quick that dye is taken up, and how much of that dye actually reaches your lymph nodes. It's a good test that looks at that deeper system. And it's really important that you get that deeper understanding, because many of us see people who will come in thinking that they've got lymphedema secondary to cancer, treatments for cancer. When you do a little bit of digging and some diagnostic tests, it turns out that actually that lymphedema is a primary lymphedema that would have become symptomatic at some point. It was just that the cancer treatment tipped the balance. And what about the extent of the edema, the swelling? It may present in just the hand or just the foot, but you may have a different asymptomatic presentation, which could become symptomatic at some point, or which could mean that you sit there and think, oh, the edema is progressing, the lymphedema is progressing. When this happens, people often blame themselves for the worsening and will often say, oh, I shouldn't have done X, Y, and Z, or I went on a big walk and then it started, or I shouldn't have gone on that long haul flight. Or on the flip side, those people who will not do lots for fear of making their lymphedema worse. Actually, it could be argued by using something like ICG lymphography, which shows the images on the left of the screen, that this would allow you to really see where there's areas that are symptomatic and where there's areas within that limb that may become more swollen, causing worsening symptoms. And quite often you can see areas on an ICG image where the patient or the person with lymphedema is completely no symptoms, just this image that is there prior to any symptoms showing. So it's a really useful imaging technique to have done. And those images show here normal linear lymphatics, functioning lymphatics, and then the bottom image where somebody's got quite a severe lymphatic failure in that area. The other test that you may be able to get done is a specialist MRI sequence, which will look at the fat to fluid presentation within your leg or your limb. And this will allow both yourself and your therapist, your clinician, to look at how to plan treatment, because it's quite problematic trying to reduce a fat than it is trying to reduce fluid. The only issue with some of these, in particular ICG and the MRI, is that they're only available privately. So accessing them privately can be quite problematic for some people. But you should be armed with all the information of those tests that are out there. Another test that's been quite easily done is an ultrasound scan, and an ultrasound scan can determine fluid within the tissues. And this was taken from an article showing where there is fluid on this patient. That top black and white image shows that there is fluid within the tissues that is present in the lower legs, and then the bottom image shows the ultrasound picture of where there is quite a presence of fat. This is conducive here with somebody that has lipedema as well. But another instrument that can be widely used quite easily is that where you use TDC. So it's a tissue dielectric constant, and a lot of the lymphedema clinics have these, where there is an increase in fluid at certain parts on an area. This will correlate to a higher reading on the device. So again, we'll give you a picture as to where does the fluid accumulate. And this all helps in goal setting and treatment planning. Once there is a clear diagnosis, treatment is then a minefield with conflicting information everywhere, and people often come into our clinic very confused as to what they should be doing and the difference between treatments between their private therapists and their NHS clinics. And one example of this, I'll get there, is that with manual lymphatic drainage. Now, manual lymphatic drainage within the NHS tends to be reserved to those people who have swelling of the midline, so head, neck, breasts, and midline, with a focus on compression and containment for limbs. So it's difficult when you're told that actually you can be offered MLD once every 6 weeks, or should you be doing simple lymphatic drainage? What kind of simple lymphatic drainage should you be doing, and how many times a day should you be doing that? It becomes quite confusing when you're told different things from different people, but the evidence suggests that MLD is a great tool and SLD can be great, but it has to be done regularly, and it does not replace compression. However, compression, another minefield. Should you be wearing it in the daytime? Should you be wearing it at night time? Should it be 24/7? Or in some cases, not at all. Should you be doing weights? Should you go for a sauna? What about dry brushing? Should any treatments you have give you light pressure or firm pressure? It's all very conflicting. What is certain is that your treatment should not be painful, should be tailored to you and nobody else. It should be based on your goals, your lifestyles, and your ability. However, on the flip side, we will always be restricted by what is available, as resources are becoming increasingly limited. So it may be that you choose to top up your therapy with private sessions. It's very important to find a clinician to work with, and that's somebody who you can build that really good relationship with, to again get on your journey with your self-management. We know that NHS waiting lists can be long, and some clinics have the option for a private care. There are also MLD therapists who are registered on the MLD UK website or the Lymphoedema Training Academy directory who can support with some treatments while waiting for an NHS appointment. There is the British Lymphology Society directory of therapists as well that you can go on and have a look at to see what NHS services are in your area. But it's valuable to work with some private therapists for topping up treatments and for advice while you're waiting to get into that NHS clinic if you can. Some will also be able to help guide you with treatment choices such as compression. So having a look on all of these directories will help. For you, it's about setting your goals. Once you're seen by a therapist or a clinician, it's really important that you're open and honest about what is important to you and to discuss this openly. We're not here to judge. We're all here to guide based on our own training. And it may be useful for you to go away and check what we've told you because there are differing opinions. As clinicians, we should be mindful of helping to set realistic goals. And sometimes we do have to have difficult conversations, but we should be mindful of the burden that we as clinicians put on the person with lymphedema when it comes to long-term management. And we need to ensure that all care is individualised to meet the specific needs of that person. However, we should be working with a two-phased approach, one that reduces the limbs or the area of swelling and one that maintains it. On this image here, if there is pitting, then that indicates that reduction can be achieved, that the current treatment is not reducing the limb but allowing it to swell. So we must take swift action if this limb is or the swelling is increasing in size. My thing to you is that if your limb or your edema is getting worse, then it's down to you to contact us. Because if you don't contact us, we don't, how do we know that it's getting worse? And if we cannot offer an appointment, because again, appointments are difficult to obtain at times and there could be a delay, for us as therapists, we should still try and offer a temporary solution that allows the person to take control of that lymphedema while they're trying to get that appointment with us. But most importantly, it has to be aligned to your goals. So do set those goals. So we reduce. Reduction with compression bandages is gold standard for lymphedema. However, it differs in the community and in clinics. There'll be different bandaging systems that may be used that are often left in place for up to a week at a time. When we are in that reduction phase, leaving a bandage in place for a week at a time is not acceptable. Evidence has shown, and evidence has been spoken about for many years, that shows that pressure of a bandage drops off after 2 hours and possibly sooner. It was just in the research, it was at 2 hours it was tested. This results in that pressure dropping, which then allows the limb to refill. And even in those clinics where bandages are reapplied daily for a period of 2 to 3 weeks, pressure drops off between reapplication, which again, you can get bandage slippage and the limb will refill a little bit. So some clinics have been trialling updated techniques that have been taught by the Lymphoedema Training Academy, which involve decongestive therapy being conducted over a 3 to 5 day period, with patients attending the clinic for up to 3 hours during a day. They have gold standard compression bandaging using short stretch cotton bandages, exercise, pneumatic compression, lymphatic drainage, and then this will be done in that 3 hour appointment where the patient will go off, do some exercise, come back, another bandage will be put on top to continue to ensure we've got that therapeutic pressure. And then the bandages later in the day will be taken off. They will pop an adjustable compression wrap on and the patient goes home. They then return the next day for treatment to be repeated and really decongest the limb over this short period of time. The patient will stay in adjustable wraps until new compression garments are fitted, and there's lots of advantages to doing this. You've got advantages of not being in bandages 24/7, having wraps that allow patients to tighten up that wrap as their limb continues to reduce, as well as having that set of wraps to use long term for titration during the maintenance phase in response to how the limb is behaving. There's also less time away from work, daily life, as treatment is condensed. So overall, as much as it increases time in clinic during a 3 to 5 day period, it is condensing that treatment into a smaller amount of time. It's less of a burden. So once we've reduced, we then look to maintain that limb, and maintenance is whatever it takes to maintain the reduction that's been achieved. Now, usually we would be using flat knit compression garments or a stiff circular knit that stays on for 23 hours, 23 to 23 and a half hours per day for at least 6 weeks post decongestion. And that can be achieved again using a single layer. We have patients that will go into a double layer of compression. We'll use wraps, adjustable wraps, or combined or as standalone. And again, it's at this point that if you, as somebody who's got lymphedema and going through this, feels that your edema is starting to increase or there's issues with your compression, you really must contact your therapist to get it back under control and for garment tweaks. Where you've been trained to do so, increase your compression if it's getting worse, but only if you've been trained to do so. You can titrate your compression dose in response to how your limb is behaving. And where possible, us as clinicians should be empowering and teaching patients to do this for that long-term management of their swelling. Only you can determine what makes your swelling better or worse, and you can choose what you do in response to those changes. So stepping up and stepping down and having the confidence to find what works for you. Thinking about things such as what to do when going on holiday. And we have this question quite a lot in clinic where people will be concerned going on a flight and they're swelling. Well, quite many people that haven't got lymphedema will swell on a flight. During the flight, it's important to get up and move around. Yes, wear your compression, but also make sure that when you get to your holiday destination, that you factor in a little bit of time to titrate your compression to enable you to get your limb back under control. The same with attending a wedding. Patients would like some different products to help them feel nicer and go outfits that are used for wedding. And it may be that there are some products that are a little bit less bulky and that are used for these occasions. But again, we will titrate compression or factor in rest after being on your feet for a long time to enable you to try and bring that edema back down. I believe that people should have different products for different occasions, lifestyles, and abilities. And yes, we're constrained by budgets and formularies, but for us, we should not be assuming that the person in front of us would not self-purchase a product if it is right for them. And if it would benefit them, especially when it's such as being comfortable whilst exercising, patients that have different products for exercising. So making sure that we've got those available. The patient toolbox is really, really important. There are many different solutions that can be used as you formulate the routine that works for you. And there's just some examples here of bandages, kinesiology tape, adjustable compression wraps, pneumatic compression pumps, and various different types of compression. Also thinking about how we get those garments on and off. So solutions for application and fitting. Often for us, we'll start our assessment when you walk through the door. And this will often inform our choice of compression earlier on. We look at what kind of body shape you've got and how you're walking. What we shouldn't be is making assumptions on how we think you will fare with compression, because there are some people out there who are nearing 100 who have what's needed to be able to get their compression on and off. So using things like donning aids, donning and using gloves help pull garments on and off and to stop you putting your fingers through the garments are really useful. Again, if people have issues with dexterity and pulling garments on and off, then things like zips, Velcro straps, or fasteners can be added. The other thing to remember is that garments will shift throughout the day in response to your swelling and in response to what you are doing. So using things like body glue are really useful for keeping them in place and you stop having to readjust them as much. Again, find what works for you and don't let it stop you from living a full life and achieving your dreams. There's a wealth of information out there for clinicians and for patients, and lots available from the BLS website resources page. Patients can also link in with patients' organisations such as the LSN, Lymph United, and Lymphoedema. Again, for clinicians out there, most of the companies will provide CPD accredited education and support you with supporting your patients. And again, it's education, evidence-based and underpinned by best practice. I appreciate you taking the time to listen to me and thank you. So thank you for listening. Do go and have a look at the BLS website and some of those websites that we've suggested, and we will take questions from the floor. So thank you.
Thank you so much, Natalie. This was really great and insightful webinar. Natalie is with us live right now, and we collected all your questions that I will ask Natalie one by one. If you have any more questions, please pop them in chat box and we will make sure that all questions asked are answered. So, Natalie, the first question is, how important is early diagnosis in preventing progression of lymphedema?
I think early diagnosis is essential. Please excuse me, I'm full of a cold. Yeah, early diagnosis is essential to ensure that you get treatment as early as possible, because the quicker we get in there with treatment, the less likely that you are going to end up with complications such as cellulitis or progression of swelling and the complications that come with that. So yeah, it's number one, and a lot of the time, again, we get people who come and see us who haven't been given the information that's needed to enable them to get an early diagnosis.
Thank you, Natalie. One of my question actually here is, we are more and more finding that patients do need to seek for help on a private basis. And there is a lot of misinformation going on social media and various information that are going on around us. How is important to be treated in clinically safe environment, and where our patient can find the information where they can be treated safely.
Yeah, I think again, Google, Dr. Google is wonderful. We all now walk around with computers on us 24/7. Um, I would just advise to be how can I word this? Cautious with what you hear or read on social media. Go to verified sources. So when you how search engines work, that if you put in lymphedema or edema, make sure that you're getting your information from those trusted sources, such as the British Lymphology Society, MLD UK. Globally, there is a lot of networks around that are full of experienced clinicians and those that have a patient voice as well. So I would always say, I mean, my first point of call for a lot of things is pointing people in the direction of the Lymphoedema Support Network, Lymph United, Lymphoedema, the LSN Forum. and for clinicians straight to the British Lymphology Society if they're in this country.
Thank you, Natalie. One of very important thing is to be treated in safe environment and by
Yeah,
clinicians who
absolutely.
are adequately trained.
Absolutely, absolutely. And just as an aside from that, it's there is a lot of people out there that will have done courses that are aimed more at beauty, where they'll have been on an online course or a 1 day course saying that they could do manual lymphatic drainage. This level of training is not enough to treat those with lymphedema. So check your therapist qualifications would be my advice as well.
Absolutely. Thank you, Natalie. I'm going on another question, and the question is, one of my regrets is not being informed about ICG mapping during and shortly after my cancer treatment. How likely is that my lymphedema might have been prevented with LVA had this happened?
That is really difficult to say. So LVA is a fantastic solution, but it's not suitable for everybody. And the surgeons that I work with will say that they only tend to offer 1 in 3 people the option of LVA surgery based on their suitability. So first of all, it's about suitability. I believe firmly that, and everybody who knows me knows I'm a bit biased, firmly believe that ICG imaging should be offered to absolutely everybody who's got primary or secondary lymphedema to be able to look at individual mapping of the lymphatics to see to inform that individualized treatment plan, but will then allow to see if there is enough function to be suitable for that surgery. So I can't fully answer that question because without it's individual to the patient.
And we also need to investigate appropriate trained surgeons who
Yeah.
are
Oh,
trained for this kind of procedures. So that is very important.
absolutely, absolutely.
Natalie, how do you decide whether you have lymphedema or heart issues like heart failure? Are compression socks safe to use until you get a diagnosis? And who gives you diagnosis?
So it's your first point of call if you suspect it must be the GP. Go to your GP. They will do a number of tests, especially if you're getting short of breath and you've got swelling of the lower limbs. If you're in compression prior to that, I would assume that you are under the care of a therapist who's prescribed that compression. Again, you need to go back to them to discuss that. If you get any shortness of breath, you must take them off. There's a great document that's on the BLS website that's to do with compression in heart failure as well. So for any of the clinicians that want to have a look at that, then please do go and download it. But yeah, I would you have to go through your GP to have referrals for the necessary tests to look at heart failure.
Thank you, Natalie. Now, one of my questions is because when you're mentioning exercising, I think every physio will jump and try to ask that question because we also want to unravel what the best exercising is the best for the patient. Do you have any system and what kind of exercising is the most recommended for more effective bandaging and
It's a
outcomes of the
it's a
bandage?
really it's a good question. So exercise in general, I would say don't mention the exercise word to me because I'm not going to do exercise, but I will go for a walk, so or move. So I think it's how we frame it. It's like the word diet, it's how you frame it. In terms of exercise during compression bandaging, a lot of what's used, it's walking, it's exercise that gets the muscles moving. You want the muscles to move against that bandage, which will help to increased lymphatic drainage and reduction of the limb. And I think generally it's whatever exercise you enjoy doing, um, and that doesn't make your edema worse. So a lot of people will talk about going swimming, but then some people will say, no, swimming's no good for me, but I can do a 20-mile hike or cycle the length of France. It's about what you enjoy that gets you out in nature or just doing stuff to get those good hormones flowing and making you feel better.
And we have a lot of new things going on in lymphedema as well. So according to that, I have a question. Do you have experience and comments on fast and go hybrid bandaging? It took it
I
easy and
don't.
convenient to use.
No, I don't. I mean, we are huge advocates of our proper short stretch bandaging that is tried and tested in the clinics. Um, a lot of patients are able to do this themselves. We can teach patients, and if yeah, so it's not something I use or have done anything with.
And following to that, one of very important question is, are there risk of under or over compressing?
So compression has to be titrated to that person and that person's abilities and how their edema is behaving. So guidelines state that we can go up to about 90 millimeters of mercury, but we have to assess the shape of the limb. Do we need any extra precautionary measures over tendons, the back of the knee or in the elbow of the arm, and it's about that full assessment that we're using. Um, Again, there's people in clinical practice that I've seen over the years that are in triple layer garments with really quite high levels of compression, and they are fine with that. There is um, again, a lot out there that says, oh, you have to be careful, even with such pressure in lymphatic drainage, not to damage the lymphatics. The lymphatics can withstand a huge amount of pressure, as can you.
Therefore, it's very important to be under clinical assessment, regular
Absolutely.
follow-up.
Yeah,
Sometimes compression can change and vary throughout the course of the treatment and long-term management. So
yeah,
it can change and the treatment decision can change throughout the
yeah,
time. Thank
absolutely.
you, Natalie. Now we're coming to a popular thing and that we always need to talk about. It is gut health and dieting. So the next question is, do you need to change eating habits like low sodium diet, or should you be minimizing fluid intake to help your lymphedema?
You shouldn't minimize fluid intake to help your lymphedema at all. Fluid intake gets restricted during heart failure or some kidney disease. And again, that is to do with you're very much under the care of a renal consultant or a cardiac consultant who will look at that, or a heart failure team. In lymphedema, you don't need to restrict your fluid intake. There's a lot out there that talks about different diets. And again, I think diet is such a quite an individualized thing. Um, the huge things about keto, I'm a huge fan and believer in gut health. I think there's so much that we do that destroys that gut health, and it really can add to inflammation. But again, it's that I often say to people, um, to point them in the direction of some of the gut health studies, but also to talk to them about, right, if you have a look at what foods you think trigger you. Um, we all know as well that the ultra processed foods are not good. So looking at levels of processed foods, and what you're eating, so keep a food diary, Res remove them, and then start adding things back in to see if anything triggers you. There's lots of people that will talk about alcohol and how alcohol impacts lymphedema. I think alcohol impacts a lot of things. Um, Yeah. So I'm not a dietitian. I only have bits that I've looked at from a personal level and some books that I've read for work and for what I do, but I don't. I tell people to just
Thank you, Natalie.
try and work it out based on their individual circumstance.
I will also add that in some of primary lymphedema, where is genetics disorder, we do know that there is a leaky gut. So
Yes,
if certain
yes.
food is eaten, it can
Mm,
irritate the bowels. So
mm,
that can be connected with the primary lymphedema,
yeah.
and anyone who is diagnosed with primary lymphedema can follow that kind of issues can
Yeah.
follow.
Yeah, and it's the
So
fats, the absorption of fats as well. There's been again looking at tests for leaky gut where they'll put ICG in some butter and get somebody to swallow it, and you can see what comes out that that absorption of fats is an issue.
coming back on the question of self-managing, and the question is, what are your thoughts on wearing a comfy wave garments when using an ITC compression pump?
You can use a comfy wave. Disclaimer for Haddenham. But yeah, we often use comfy wave under pneumatic compression pumps because it helps to soften the limb at the same time. It just enhances that effect. So yeah, there's not an issue there.
Thank you, Natalie. The next question is, I only have one type of simple lymphedema drainage, which
Mhm.
involves much movement, and I cannot stand because of osteoarthritis. Is there any exercises which I can do sitting for simple lymphatic drainage?
Again, there was some really good videos that were shared, wasn't there? On lymphedema awareness last year or the year before. Um, that was it. Oh, I can't think. I can see her face, but I can't think of her name. There's some really good videos that show chair-based exercises for lymphedema, and it's basically just again, if you're thinking about that in terms of simple lymphatic drainage, excuse me, anything that allows you to squeeze those lymph nodes at the back of the knee. So sitting in the chair and lifting and bending the knee, and using um lymph balls into those, yeah, one of those um can help with that. But there is some YouTube videos. Carla did some YouTube
Ah,
videos that are
mm.
really good chair-based exercises that will help with that. But it is about movement and drainage. The more you move, the more it influences your lymphatic drainage in a positive way.
So breathe, it's for free. It's the best exercise for lymphatic system. Yes. But we all also coming to our big question where we all fight and for better recognition. And the next question is leading to that is, how can primary care better support patient before specialist referral?
Oh. Um, Early referral. So if a patient comes to you reporting that they've got swelling and that swelling has been there, we say diagnosis of 12 weeks or more, get them referred as quick as. Um, Basic advice that it's really difficult, isn't it, for primary care because you get what 10 to 15 minutes for an appointment, and what can you do in that 10 to 15 minutes? Point them in the direction of again, some of the websites such as the BLS, Legs Matter have some really good patient information leaflets that look at just general advice on skincare, exercise, getting that referral into the specialist care as quick as possible. If you're able to do attend more training that will allow you to confidently assess and prescribe compression, I definitely look at doing that. But again, it's that I know that our primary care colleagues are stretched beyond capacity and being asked to do such a lot. So again, looking at those directories that allow patients to look at possibly getting a private practitioner until they can get into that lymphedema team.
Thank you, Natalie. The next question, what are your thoughts on lymphatic massage therapy?
Lymphatic drainage, proper lymphatic drainage, certainly has a place, and it is very effective while you do it. It's that the results have to be maintained with other treatments. So it works while you're doing it, and it lasts for a number of hours or a day or two. So it's part of a combined treatment. But it has a huge benefit. It does have a huge benefit.
And adding to that, do you have experience and comments about deep oscillation therapy?
See, deep oscillation is not something I've used in clinical practice, but I am very aware of the benefits that people report. I have managed to I played with one of the devices last year, and it's a really interesting feeling having it done. But yeah, I'm certainly get lots of reports of people saying about it's improvement in softening of tissues and movement. But it's not something that I've used.
Thank you. Natalie, is there any possibility of wearable pump in the future to help with drainage?
What do you mean
Wearable,
variable?
that it can be worn.
Oh,
That
wearable,
they,
sorry.
yes.
So in terms of, it depends if you're looking at pneumatic compression pumps, or there's technology out there that isn't a pump as such, but uses different mechanisms to massage the limb. There are portable devices that can be used that you can without having to plug them in. But they're still quite, you've still got to be able to have air in them that compresses the limb. So whether you'll be able to walk around with them on would be challenging.
Uh, Biomaterials now that are coming on they're under clinical research, so we do have
Hmm.
a hope about some innovations in lymphedema as well.
Yes.
Uh, and we are coming back to patients' always concern is how do you support patients who feel overwhelmed and disengaged with the treatment?
I think you go back to the beginning. You have to go back to the beginning. Strip it right back. Because, and this is what I said in my session, it's that we're very good as clinicians saying you've got to do this, and this. And it is overwhelming. There's times that, and again, I've said this when I've been teaching, there's times that I will do an initial assessment and I won't even discuss compression, because actually we've got to peel back the layers first and then look at the understanding and actually set some goals. So my advice would always be strip it right back.
And that leads to the question, where are the realistic expectations? Can
Mm.
lymphedema be reversed or can be only be controlled?
It's controlled. There is nothing that actually reverses it at the moment or cures it. Even those that say, oh, LVA will cure it, it won't. You still have an underlying lymphedema, a lymphatic problem. Um, it's about managing it and reducing the burden.
Natalie, what are the barriers to accessing lymphedema services?
I think there's a lot of barriers. We've got a huge challenge within the healthcare system at the moment with services that are being cut back or closed. Um, I think from a commissioning perspective that something needs to change and that it needs to be seen as really important to commission these services. With that, we've got services that have got very long waiting lists. I also think that there's just a lack of knowledge out there, and as much as we try and raise awareness, people are not aware of, oh, I can refer to here. or there's a service there. There's then the actual postcode lottery of with services of will the say primary lymphedema, secondary lymphedema, non-cancer related, cancer related. It's finding services that actually see
Which lead to the
patients.
next question. Are there any community resources or self-management programs available that
Um,
patients?
Again, it's Legs Matter, BLS website, the LSN website, Lymph United, Lymphoedema. Have a look at those websites. There's lots of resources out there that will allow you to have written information on self-management.
Thank you, Natalie. I'm coming to our last question is, what is the most common myth about lymphedema you would like to correct?
Oh, that's a controversial question. I think the most common one of there's a few. Oh God, I think the most common myth that I would like addressed is that actually that your lymphatic drainage has to be really light. Because when you've got someone that has got quite a big swelling on that limb, uh, and the tissues are quite firm, you've got to put more than light pressure on that. And we've seen that using ICG imaging, that light pressure really, you should put a bit more pressure on. So that's
Thank you. Thank you, Natalie. Thank you for this really important and insightful webinar that we have today. It was really enjoying to listen to you and listen all questions that we have. I would like to thank all participants and all their questions. I would also like to mention about our BLS non-lymphedema specialist study days that will happen in Bristol on Thursday, 4th of June, and in Chester on Monday, 5th of October. These study days are designed to ensure that non-lymphedema specialists can have introductory study day about lymphedema and how we are approaching to lymphedema care, how we spot lymphedema early, how we provide supportive care, and we collaborate effectively among specialists. Also today, I would like to thank because this is our last webinar for Lymphedema Awareness Month, and I would like to thank to our sponsor, such as Haddenham Healthcare, Essity, Bluzo, Daylong Direct, LNR, Medi, and Patient Choice. And I would like to thank every one of you joining today and sharing this knowledge and your thoughts and your worries with us. Thank you so much.